So I'm really enthused that we're talking about systems, because actually there are deep structural problems in a lot of our systems, and my particular interest is about sustainable healthcare, something that I've been interested in for nearly 20 years now, and I'm glad it's starting to get on the agenda. Just to make you aware, the NHS is responsible for about 4.5% of the carbon footprint of the entire country. So 1 in 20 emissions is from the NHS. So if the NHS were a country, it would be the equivalent of the entire emissions of Denmark. So the idea that we can continue in the way that we have done and still be aligned with planetary health, I'm afraid, is not true. So this is something that we've been trying to work on. And I think, you may say, well, what's that got to do with our local population? Well, actually it does, because climate change and the effects of that are going to affect the most disadvantaged. I can live in my nice, comfortable house, of course, and if there are bad weather, it's okay. If food prices go up, it's okay, I can cope. So, but the least disadvantaged will be affected, and our research is looking not both locally, but also nationally and also internationally, because these deep-seated problems are, of course, not related only to what's happening in Sussex. So what do we do? I think there's 3 themes to what we do. The first is research. You're going to hear about some of that. We move towards clinically led research or informing clinical practice in sustainable healthcare. We also undertake policy, as I mentioned, local, national and also international. And then we're involved in education, because what we find is that although our communities, clinical communities, are really interested in sustainable healthcare and really engaged with it, multiple surveys show over 95–98% of the clinical workforce want healthcare to be more sustainable. They don't actually know what to do. And so we're trying to engage in that education to lead to behaviour change, to lead to real world impact, not just papers that are coming out. So to give you a little bit more detail, the research historically, the idea of the NHS being greener has been around for a long, long time, at least 15 years. And people were originally focused on estates. Oh, our buildings are terrible. They are terrible, but it's much more than that we need to deal with. It's not just insulation and LED lighting, and as I said, it's clinical-led transformation, and that must include public health. I must admit, we're not doing a lot of work on public health, but of course, public health is going to improve the health of our population and reduce our carbon footprint, because it will reduce reliance on our health systems. If you use active transport, cycling and walking to get to work, obviously your health is going to be better. The number of medications you use and your utilisation of healthcare is going to be better, and perhaps some of those health differences in terms of life expectancy can also be reduced. So in terms of care pathways, of course, we need to change the way we deliver care, and some of that might include novel methods, including remote care, digital care. For example, there's some work going on where patients' wounds are just analysed by videos sent remotely, and that's actually good for patients because they don't really want to come in. We need to enable that, and we need to understand that there are people who are not left out of that digital transformation. And Cheryl, who's probably here somewhere, has got a poster about that for those who want to look at that later. Our particular focus has also been on equipment, and because in healthcare we throw away an incredible amount of stuff. For those of you who've been in health settings will see that. So examples, 93 million drapes and gowns used every single year. 52 million single-use surgical instruments used every year. These are the sorts of scales. 1.7 billion gloves before the pandemic used every year in the NHS in England. That cannot continue if we want to move towards planetary health, and so a particular focus of us has been about the supply chain and what's led to this throwaway economy and how we reverse some of those drivers. So you'll hear today from Chantal about the carbon footprint and the environmental impacts of this linear economy. You'll also hear from Jasmine a bit later on about the labour rights issues associated with these linear supply chains and things that we throw away, something that I've been working on, as I say, for 20 years. How do we create change? I'm working with the Infection Prevention Society to bring sensible guidance that allowing reuse so that patients are not compromised. I'm working on the health economics, because everything we found so far shows that the NHS is going to save absolute millions by being green. And I'm not naive to the fact that that will be a major driver for these changes. And we need some behavioural science. So Caroline here is working with us on some behavioural science. In terms of policy, we have been lucky to be engaged locally with Care Without Carbon, who you're going to hear from. Susie's here's going to tell you about the work they're doing locally that can be mapped nationally to help health systems, particularly hospitals, but also community care, to decarbonise their processes. We're also working nationally, so I'm an advisor to the government on the Greener NHS, as is Chantel, to try and inform those big changes that we need. And we also have come out next month, the first report by any specialty. It is in surgery, because surgery is so terrible. That will be released next month. It's called the Green Surgery Report, and all the surgical colleges have signed up to an evidence-based approach to give people in the clinical sphere the tools they need and the education they need to drive that change forward, because it needs everybody to be on board, and we're trying to support that process. Internationally, I think particularly on the issues of supply chains, I've been working on labour rights issues, as you're going to come and hear. You're going to hear about later on, and that includes UK policy. So we've actually managed to change policy this year, where some of the medical products are now recognised as a high-risk product for labour rights abuses. And you'll hear about some of those later, including particularly gloves, and that was something that myself with group led, and I've also been collaborating with the Five Eyes, the 5 largest economies across the world, to also embed this into their supply chain. So that includes US, Canada, Australia, and the UK, and also at European Union level. So we're trying to change things both nationally and internationally, and I have to say, I think it's fair to say that BSMS is leading the way in that. And then finally, we're going to hear about education, and Heather's going to speak to you about education, and that includes both, it creates communities of practice, so it is about educating people both at undergraduate level, and BSMS has embedded sustainability into our medical curriculum, but we're also developing postgraduate education, and we've got a large conference which brings together actually communities from around the world to talk about how we enable these changes. So that's probably enough from me, and I'll hand over to Chantel first. Thanks.